Hi, Dr. Pelto here. How is it that you take care of a neuroma, something called a Morton's neuroma? That's what we're going to look at this episode. What we're going to look at today is something called a Morton's neuroma, or just a neuroma. The reason it's called a Morton's neuroma is because it's in the third interspace, so we're going to talk about that in a little bit. So the first thing you have to ask is, how long have you had symptoms? Now, if you've had symptoms for years and years, you should probably see someone. It might be a little bit beyond the scope of this video. Okay, what treatment options have you done before? Have you done anything? Have you tried some of the basics? We're going to go over some of the basics and some of the more advanced techniques. How does this impact your life? Is it something you're limping around all the time? You feel kind of a numbness and tingling in the toes? Or is it something that really doesn't bother you? And so what we're going to go over is what you have, why you have it, and what are some treatment options. So let's get right into it. What is a neuroma? So a neuroma is this little space here in the third interspace. Okay, people say that it feels like a sock is bunched up in the front of the shoe. That's what they say. So if you look at this picture here, up on the front here, this is between the third and the fourth metatarsal head. Here is the neuroma. You can see how it's red right in there, okay? And if you see, there are nerves going to all of the web spaces, and this feeds the adjacent sides of the third and the fourth toe, but there's also one in the second interspace, also one in the first interspace, and this can be caused by a tight, close proximity of the bones. It can also be caused by some other things. I really like this picture here on the bottom. Do you see how this, it actually looks bigger here, and it's underneath this ligament. This is called the deep transverse metatarsal ligament. It's right underneath there, and it gets thicker. And then it causes this numbness, tingling. It takes up space inside of there. So that's what a neuroma is. The most common symptom is it feels like a bunched up sock in the shoe. Okay, something's bunched up in there. There are other things that are very similar. We're not going to go into those, but this is what this feels like. What imaging do you do for it? Well, an X-ray can help. An MRI can be done, but what I find is most beneficial, and here you can see, is this neuroma, this little black thing that pops up here with a diagnostic ultrasound. Okay, here's an example of an MRI where you can kind of see it, and there are some other images, kind of a rendition of what it looks like as it's popping up and down in between the interspace. You can also do an X-ray, and sometimes an X-ray can be beneficial as well. What are the options? Well, you can ignore it. Most people ignore it until it hurts too much. You can try conservative, or the things that we're going to go over today, or you can do surgery. We're not going to go too much into surgery, but try to avoid that if you can, in my opinion. But you may see a doctor that has a different opinion.